Hello, my name is Elizabeth Lowenhaupt. I am a pediatrician and a child psychiatrist, and I'm here today to talk with you about polypharmacy, or things to consider for our pediatric patients taking multiple psychiatric medications. We will consider 5 things. First, what are the potential risks and benefits of polypharmacy? Second, is our psychiatric diagnosis accurate? Third, what is the role of medications? Fourth, is our dose therapeutic? And fifth, how can the medications be tapered? The first thing we would like to consider are the potential risks and benefits of polypharmacy. Polypharmacy simply refers to a patient taking more than one medication at the same time. We have a fair amount of evidence to support using psychiatric medications for a number of different psychiatric diagnoses. However, there's almost no evidence to support using multiple medications at the same time. This does not mean that it is not effective and safe at times, but it does mean we need to think carefully about the risks and benefits. Sometimes when patients take a medication and experience side effects, those side effects can be worse if the patient is taking more than one medication. Patients can end up on multiple medications in 3 different ways. First of all, some patients are experiencing symptoms that do not resolve fully, although there's some benefit from the first medication, so they end up taking another one to augment the first. Sometimes patients experience side effects from the first medication and take a second medication to address the side effects. And finally, third, some patients have more than one disorder or diagnosis that respond differently to different medications. So when patients are taking more than one medication, additional monitoring needs to happen. It's fairly simple and similar to the monitoring you are doing for patients on any medication, but you want to consider a physical exam, sometimes including cardiac, vital signs, especially looking at weight, and additional labs and studies as appropriate depending on the medication, perhaps an EKG, perhaps metabolic labs. The second thing we want to consider is the accuracy of our psychiatric diagnosis. Children and adolescents are developing. They're changing constantly. They're responding to their environment, to their family, and in particular to trauma or traumatic experiences they may have been having. Often, their response to these different external factors may present similarly to psychiatric diagnoses such as ADHD or anxiety or even psychosis. It is critical in considering medication regimens as well as other treatments to make sure we are starting from the accurate diagnosis. Once we are confident that we are working from an accurate diagnosis, and we're continuing to review our diagnosis as we go, we want to think about what is the role of medications. Medications are most effective when used as part of a comprehensive treatment plan. In addition to the one or more medications that are being used to treat a patient, what other pieces are in place? What types of evidence-based psychosocial interventions are available? Is the patient participating in individual, family, and group therapy? And what other home and school-based services and supports are in place? When we are thinking about using more than one medication, again, based on the risk and benefit profile, we want to make sure that medication is being used effectively with all of the other pieces of the comprehensive treatment plan. One very basic question to ask when a patient is taking more than one medication is whether or not the dose is therapeutic. It is always best to optimize the dose of existing medications before adding additional ones. Given the side effects and potential risks we've discussed of patients taking more than one medication at the same time, it is important to think first about which medication is doing what. When a patient is on more than one, it is hard to tell which medication may be working or which medication may be causing side effect. So again, it is best to start with one and go to the highest tolerated dose. Once the dose has been optimized, then the decision needs to be made, should the patient continue on this medication? Has there been enough of a benefit to support continuing that medication and adding a second one? Or is it best to stop the medication, determine it to be an ineffective trial, and replace it with a different medication? Finally, there will be patients you treat who are already taking multiple medications. The question then becomes, how and when can the medications be tapered? The safest approach is to consider timing first. Think about whether the patient is doing well, whether there are any upcoming stressful events. When the patient is doing well, that is probably a good time to start talking with the child, and the family about when and how to begin that taper. The next thing to consider is which medications to taper first. Always start with medications that have the most potential for causing side effects or have the least evidence that they have been helpful. Tapers should be done gradually, slowly, and one medication at a time, with close monitoring. If the child starts to exhibit more symptoms, then you know which medication was impacting that symptom, and you can quickly resume the previous dose. Ultimately, the goal will be to have the child on the fewest medications with the least possible side effects that are still effectively managing that patient's symptoms. In summary, as pediatricians, we all treat patients who are taking more than one psychiatric medications. We want to consider carefully the potential risks and benefits and make sure that we're monitoring the patients appropriately. We want to think about our diagnosis. Was it accurate in the beginning, and is it accurate still now? We want to carefully consider the role of medications as part of a comprehensive treatment plan, and think about whether or not our dose is therapeutic of each medication that is being prescribed. And finally, we want to make sure when the patient is ready, in careful consultation with the child and the parents, that we are always working towards tapering medications so that patients are on the least medications possible with the fewest potential side effects and still the greatest benefit. Thank you very much.